to the baby of having abnormalities. So it's very important, if you have diabetes and might be considering having a baby, that you discuss this with the healthcare professional looking after your diabetes.
Smoking increases the risk of cancer, heart disease and stroke, and also increases the risk of developing type 2 diabetes. If you have diabetes and smoke, your risk of developing complications is greatly increased. Diabetes and smoking do not mix well. Dr. Anne Gold explains.
Smoking has a bad effect on your health, whether you do or don't have diabetes. It increases your risk of lung disease. It increases your risk of many types of cancer, not just lung cancer. And more importantly, it causes hardening of the arteries. We know that people with diabetes are already at a greater risk of hardening of the arteries. And by smoking, as well as having diabetes, that risk is greatly amplified. In other words, if you have diabetes, your risk of having a heart attack is increased probably by about fourfold. Your risk of having a stroke is doubled if you smoke. The risk of getting leg ulcers or gangrene is also significantly increased. And in men, impotence can be made worse by smoking. People with diabetes are already at a greater risk of high blood pressure, and that smoking increases that risk further. If we think of the complications of diabetes, retinopathy, the eye problems, those are made worse by smoking, partly because your blood pressure is increased, but also because there are toxic chemicals in tobacco smoke. The risk of kidney problems is increased, and the risk of the nerve problems or neuropathy are increased probably about 12-fold. So there are many reasons to consider giving up smoking if you do smoke, and it really has to be giving up, because if you cut back, that doesn't really make a big impact on your overall risk. But the good news is if you do give up, the risks that I've mentioned all fall back very quickly towards those of the non-smoker. So it's certainly worth considering in helping your overall diabetes management.
Hello.
Hi.
Hi, what can I do for
I'm
you?
really trying to stop smoking. I was in here a couple of weeks ago,
Right,
and you advised me to go and think about it, and so I'm back, and I wondered if you could recommend anything.
There's an inhaler device which you use a bit like a cigarette, but you just inhale it, breathe in the actual nicotine, which is slightly healthier than smoking itself, because you're not getting all the tars and things.
There are many different ways you can get help to stop smoking. For example, your GP, diabetes clinic or local pharmacist may be able to give you advice or at least inform you of what is available where you live. In addition, many towns have health information points where you can speak to advisors.
You say you've tried before. You've made some quit attempts before.
I have.
How did you go about that?
I've tried a few times. I've gotten up sometimes in the morning and said I'm going to stop today. But I lasted about 11 o'clock, if that, so I didn't really go a long time with that. But I have tried the patches. It was half-hearted, to be honest with you. My partner, my husband, was nagging me really that I should stop smoking, and the children was saying that, oh, you shouldn't be smoking, Mum, it's not good for you.
Many people are concerned that if they give up smoking, they will gain weight. Dietitian Kira Heverin will give you some useful tips.
The benefits of stopping smoking far outweigh the problems associated with weight gain. Here are some things you might think about to help you avoid putting on weight. Have a healthy, balanced diet by eating regular meals, eat lots of fruit and vegetables, and choose lower fat options whenever you can to keep the calories down. And avoid fillers like biscuits, cakes and crisps. Try fruit or low-fat savoury snacks or sugar-free chewing gum. If you seem to be getting hungry between meals, plan to have a healthy snack about 2 to 3 hours after your last meal. If the snack is planned, you will have the right foods handy. At the first sign of hunger, drink a glass of water. If you're still hungry 10 minutes later, have a healthy snack. Don't be tempted to eat a larger portion than you would have before, and avoid second helpings. And if you usually smoke after a meal, try leaving the table immediately. Try to keep occupied so you are not tempted to eat out of boredom. Find a hobby that keeps your mind and your hands busy. By being more physically active, you can help prevent excess weight gain by burning up more calories. Eating healthily, getting active and stopping smoking are 3 excellent habits for improving your health.
Can you give any advice for someone who has just been diagnosed with diabetes?
First of all, don't panic and take which I must admit I did, and then take the advice that's given from the GP you're in the diabetic clinic and try and change things that they want you to change. It's like just changing little things, but they could make a big difference.
My advice would be not to take this diagnosis as something that is going to change your life utterly and completely. It is something that is serious, but all you need to do is to take it seriously and introduce a measure of control in all you do, but that deep down your standards of life will be very little changed.
Really to listen to what advice you're given and find out as much as you can about the condition and follow the guidelines.
There's plenty you can read up on it, and that gives you lots of ideas on how best to sort of deal with it, and and gives you that bit of incentive because you can read the things that go wrong as well if you don't. So it's best to look into it, and just because if you face up to it you can really deal with it quite well, and as I say, it doesn't really need to affect your life too much.
Do more exercise. If you don't do exercise, do more exercise. Stop eating rubbish like drinking cans of Coke, eating bars of chocolate, eating chocolate biscuits, sweets, and start eating fruit and vegetables and things that are actually good for you.
I would say the most important thing is to speak to someone else who has diabetes, and to also to get as much information as possible about it, because the more you know about it, the more you can control it, and I think that's the key.
Well, my advice is to take it as it is and just face up to it. Don't try to hide it. Don't think it's a terrible, life-shattering thing, because it's not.
Take good note of everything that's said to them and try it and follow it within reason to the letter, because we do all get careless and get a bit sort of jack the lad about it, and there's no mild cases of diabetes. If you've got diabetes, you've got diabetes, and that's it. Whether you're on insulin, tablets or diet, it's a serious illness and it must be treated like that.
We hope you have a better understanding of your diabetes. Remember, if you have any problems, you can phone your GP or NHS 24.
Other DVDs in this series are Childhood Diabetes, the No-Nonsense Guide. An educational DVD for those who care for children with type 1 diabetes. Teenage Diabetes, an educational DVD for carers and teenagers with type 1 diabetes. Pregnancy and Diabetes, an educational DVD dealing with early pregnancy in type 1 diabetes and for those considering pregnancy. From Pills to Insulin, an educational DVD for people with type 2 diabetes who are switching from pills to insulin. Type 2 Diabetes, the No-Nonsense Guide, is an educational DVD for everyone who has type 2 diabetes.
The Small Video Company, setting the standards for others to follow.